One of the things that just drives me nuts, and it's not about you guys in particular, but maybe you've said this, and I don't know, maybe I've said it myself, is one thing you'll find before or after I adjust you is one of the things that I tend to ask my patients is, are you looking after yourself? Because I like to know, are you living a healthy life and trying to be as healthy as possible? And one of the things that I've heard over and over and over and over again over the course of my career, which is about 10 years now, is when we talk about nutrition especially, one of the phrases that gets bandied about by people when they tend to make decisions that they don't see as optimal is, I've fallen off the wagon, okay, when it comes to their nutrition. And if you've ever been to our Maximized Living workshops, and you'll see why today is so much vastly different than Maximized Living and what we taught, it was very, very eat this, is all about eating, making these choices, making these choices, making these choices, making these choices, and as long as you're making them, you're feeling good about yourself, and then when you stop making the healthy choices, then all of a sudden you start to feel guilty, and then the guilt fuels anxiety or stress, which makes you want more stuff that you don't think is healthy, and it starts this downward spiral. And so what my whole goal tonight with you guys is to change how you look at nutrition to a point where there's no wagon anymore. Does that make sense? So we want to burn your wagon. Okay? We want to literally blow it up and destroy it, and you will never after tonight say that I fell off the wagon again. Is that fair enough? Sounds good? So that being said, most of you guys are here for a reason. Generally, maybe when you think nutrition, you want to lose weight, you want to feel better, right? You want to look better. But I think the bottom line and end of the day story is we all just want to be healthier, right? Is that true? Does anybody here not want to be healthier? Okay, good. Glad. So that being said, what is healthy? How do you define healthy?
You're not sick.
You can see right there, it is not a lack of disease, so I'm sorry you're wrong. But there you go, Louis, you won't answer any more questions. Okay. But here's what healthy is not. Okay, healthy is not being skinny. Skinny people die of cancer and heart disease all the time. Okay, it's not feeling good, because the reality is that everybody feels good until what?
You die.
Until you don't feel good, right? Or you die. In a lot of cases, the first, I think it's 54% or 60% of heart attack victims, their first sign or symptom of heart disease isn't a pain in the shoulder, it isn't a crushing chest, it isn't a shortness of breath, it's literally death. It's like feel good, feel good, feel good, feel good, dead, right? So just because you feel good doesn't mean that you're healthy. Normal blood work, you go to your medical doctor, they measure your sugar, they measure your cholesterol, they measure all that stuff. My dad had a heart attack with a normal blood pressure, normal cholesterol. Okay, so that doesn't guarantee you're healthy. Normal test results, again, that could be any kind of test that you want to do, a scan or whatever. And again, just because you don't have disease today doesn't mean that you're healthy. Because the reality is cancer could start forming in your body tomorrow. But that doesn't mean that you're healthy today. You guys see that, right? So I kind of want to throw that out. Because when you have this perception of health, then you're going to start asking questions. And a quote that I'm going to throw at you, a guy that I respect very much within our profession, and I learned a lot from, his name is James Chestnut, is he always says the quality of your life is directly proportional to the quality of questions that you ask. So in other words, if you ask the right questions, you're going to get the right answers. If you ask the wrong questions, you're going to get the right answer to the wrong question. Does that make sense? So when you start talking about nutrition, specifically to what we're talking about here, if you view this as health, if this is your definition of health, right, feeling good, being normal weight, normal blood work, then your questions you tend to ask are, what do I take if I'm diabetic? Like, what drug do I take? And then you say, well, I don't want to take drugs, so what herb do I take? And after a while, you're like, well, I don't want that. So what foods do I eat to cure my diabetes? Or what foods do I eat to lower my cholesterol? Or what foods do I eat to drop my blood pressure? And then you can get into such things as, do I take this supplement for it? Do I take curcumin? Or do I take, I don't know, colloidal silver, whatever it is. But whatever it is, your whole point with all of those questions is, what do I take to have to suppress these symptoms or blood results or whatever so that I can be normal and feel good again so that I'm healthy? And there's a problem with that, and I'm going to talk about it in a second. Because what the true definition of health isn't feeling good, and it's not having normal blood anything. The true definition of health is when your body is able to function, heal, and adapt to its surroundings. Okay, that's the true definition of health. When your body's able to do that, you are healthy. When your body stops being able to do that, that is when disease sets in, and that's when you become sick. And the analogy that I'll throw at you, less than perfect, is think of adapting to your environment when it's cold outside. Okay, you guys can all remember when it was cold outside out there? This morning, right? You go outside and it's cold, what does your body do?
Shiver.
Shivers. Do you know why your body shivers? trying to keep your core temperature up. So that's an example of your body being healthy, right? So if you look at a room full of people who aren't shivering, okay, and then you look at one person who's shivering outside, and you go, well, they're not like them, so they must be different and sick, right? Whereas in reality, the person's body's doing the right thing in its environment. So you shiver to start to warm up, and different things happen as well, and I won't get into the whole physiological response of it. But when does being cold truly become a problem? Like when do you truly have issues with being outside and cold? It's not when your body's trying to warm up, it's when your body, what? Stops being able to, right? When you can no longer create warmth by shivering and all these other things, that's when you die. And the same is true, we're going to talk about that. So the best question that you could possibly ask, instead of saying, what do I take for this or what do I take for that, is what do I eat when it comes to nutrition to support my body's ability to function, heal, and adapt to its surroundings? And what do I eliminate from my diet that would interfere with my body's ability to do so? Can you see how this is a different way of looking at it? And the best analogy that I can give you, and I'm not sure where this is going to go. This is the first time I'm trying. I tried it on one patient earlier, and she kind of looked at me like, okay, so I don't know how I'm going to be at explaining this. I'm going to do my best. When you look at it this way, what you're essentially trying to do is pool all of your decisions with regards to your diet, so all the foods you eat, all the exercise you do, all the thoughts you think, whatever your actions are, okay? And you're trying to take all those decisions and gear them towards an outcome of being healthy. Does that make sense? So you're trying to hope that all the things that you do add up in the end to you being healthy. Okay? Now, the problem becomes, is what if the things that you think are healthy, the decisions that you're making are being healthy, actually aren't? So can anyone think of some point in history where someone told you that something was good for you and then came back and said that it wasn't? Can anybody think of something like that?
Yeah, they would always say that you can have potato.
Right.
If you're diabetic, and whether you're diabetic.
Right, so here's potato,
diabetic. In starches.
There's an example, sure. But then you realize after that that's not actually good for you.
Well, they tell you not to eat saturated fat.
Saturated fat.
And now they're telling you you should.
Yeah, margarine and butter. Yeah. Right? How many people switch from margarine or from butter to margarine, and now we're back to butter? Another example of that is in the 1960s, the American Medical Association actually endorsed certain brands of cigarettes, saying they were best for you. It's absolutely insane. So the problem when you do this, when you're chasing this is what's called inductive reasoning. And this is going to get a little philosophical here, but it's important we talk about this because this plays into the whole role of when you leave here, you're going to have a lens through which to view your nutrition, your diet, okay? It's not so much lists of things, okay, but you're just going to look at it different. And this is how I want you to think. Inductive reasoning is like if you took a tape measure and someone sat 50 carrots in front of you, and you measured all 50 carrots, and they all fell to between 7 and 11 centimeters long. What inductive reasoning does is it takes what's common for all, or common for some, and expands it to all. So then you could conclude with inductive reasoning, if you measured all carrots, and they're all between 7 and 11 centimeters, in those 50 carrots, you could then conclude with inductive reasoning that all carrots are between 7 and 11 centimeters. So what applies to a bunch applies to the whole, okay? Now the problem becomes all carrots measure between 7 and 11 centimeters until you find one that doesn't, right? Okay, and we laugh, but then we think, well, what is normal blood pressure? What is normal temperature? What is normal pulse? What is normal cholesterol? What is normal blood sugar? Right? Did you know at one point, normal cholesterol, they lowered the standard? You guys remember this? This was, I think, 11 or 12 years ago. They did it in the States. I think at the time it was the numbers were 150. It's different in the States. I'm not sure what it was here. It was 170. They lowered it to 150. So normal cholesterol. So if you went to bed that night and your cholesterol was 160, you were healthy. The next day when you woke up after they lowered it to 150, all of a sudden you were sick. Isn't that crazy? But that's for all of us. That would be like going to a tailor. With the average human being is 5'9", 150 pounds. You go to your tailor for a suit, and they hand you one that's average. But you're like, but wait a second, I'm 6'2". You know, like it doesn't make sense when it comes to your tailor, to suits. Yet we do that for health. Now, what deductive reasoning is, it's a little bit different. Is instead of saying I'm going to take all these decisions and add it up to the outcome, you're going to take that outcome and you're going to allow that to influence all your decisions. Does that make sense? So you're working top down instead of bottom up, okay? And so by the end of today, what I want you guys to walk out of here, instead of having the list of, you know, are potatoes good for me, or can I eat oatmeal for breakfast, or whatever it is, okay? I don't want this to turn into a bunch of rules and lists and everything else. That's not what the goal of today is at all. I want to be able to equip you with a lens or a paradigm where you can look through it, and you can pick up a product, and you don't even need to know if it's on a list or not. You can just look at it and go, well, I'm not eating that. And the reason you're not eating it is because it doesn't support my body's ability to function, heal, and adapt to its surroundings, or it can blatantly and outright interfere with that process. Is everybody making sense? Did I get that across in an okay way? Okay, a couple nodders, a couple people dozing off in the back, that's okay.